It's Scissors and Scrubs again. I'm Nicole.
I'm Laura.
And, a couple of years ago, we gave you the episode that keeps on giving, and we're going to do another one on STDs for Valentine's Day.
Yep.
Love is in the air. La, 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 la. We could talk about what we do on Valentine's Day, but I really don't do much. My husband might take me to dinner, might not, but we never go on Valentine's Day because that is rookie night. So,
It is a Saturday night this year, though.
I still don't want to go out with all the little people who are getting engaged.
Ew. I've never seen anybody
We went
get
out.
engaged
One
on
year we went out.
Valentine's Day.
We went out to the Chat House in Boston.
Oh.
Couple next to us gets engaged. I'm like, huh. He's like, don't even think about it. We had like been on 3 dates or something. But yeah, it was pretty funny. And so I'm like, no, I don't need to be out with all the, I got to spend $4 million. And no.
Can you go to the speakeasy?
We could go to the speakeasy. That's a great idea.
Like you can go out. You don't
We
have to
can
go
go out. I
to
just don't want to go like
That's
on
what I'm
a
saying. It's a
traditional.
Saturday night, so it's tough to waste a Saturday night.
Yeah, but would you guys want to be alone on Valentine's Day?
No, why would I ever want
All right, let's do something on Valentine's Day. It's a date. It's a date.
I know where it is.
You know where the speakeasy is? Yeah, you went without me, you bastard. So Brian, my husband, has accompanied us on this. For Valentine's Day, we have both of our husbands here for this episode.
Oh, yeah.
Yes, my husband.
It's very romantic.
So there's a speakeasy in this little town that I've been dying to go to. And, I had to work on a Friday night. And sometimes my husband gets together with his friends and they drink whiskey on Friday nights. He sends me a picture of the menu from this fucking speakeasy.
No, you're leaving out the fact that we've been talking about going to the speakeasy
For years.
All of us.
For years.
And he sends it to the group chat with
That's right.
all of us.
That's right.
And we're like, what is happening?
I'm
What?
like,
What?
and
I'm
I'm like,
I
why
know
would
Nicole's at work. And what? And
why
then-
would you send this to us? And then it's like dead silence because now we're all reaming him a new asshole in the group chat. Like, what are you doing? And then you did something. Like you sent a picture from the inside ordering. And now it's like, what are you doubling down?
Yeah.
And then one of his friends starts chiming in on a separate chat to me. I'm like, dude, quit while you're ahead. I'm
the
over
kids
here.
are like, wow.
Yeah.
Maybe stop. Like,
Nope.
I'm very transparent.
Yes, very transparent. Okay, so
that's
love
what
it.
we'll do.
Love is in the air. So we're going to talk about some STDs that I have never heard of. One or two I have.
Yeah.
But they're
it's
disgusting.
like, I was like, oh, that's a thing.
Yeah, STDs are they're never nice to talk about. There's never something pleasant with these.
Why would there be?
Well, I'm just saying, like, that's not like,
They're not fun.
they're not fun.
No.
Ever. All right, Laura, you want to start or should I
Sure,
start?
I can start.
All right.
I got all my information from all of these from Cleveland Clinic.
Same.
I'm gonna
I have the CDC too.
I'm going to start with bacterial vaginosis.
That just sounds disgusting and smelly.
Well, bacterial vaginosis is a vaginal infection caused by an overgrowth of bacteria. All healthy vaginas contain bacteria. Well, all vaginas contain bacteria.
You mean there's no sterile vaginas out there?
Everybody has bacteria. There's good bacteria that you're supposed to have, and then there's bad bacteria. When the bad bacteria grows too much and overpowers the good bacteria, you get bacterial vaginosis. Bacterial vaginosis may cause your vaginal discharge to have a fishy odor.
Low tide.
It can also cause vaginal irritation in some people. Others may have no symptoms. It is the most common vaginal problem for women ages 15 to 44.
Oh, I guess I'm out of that problem.
We missed this problem.
I'm good.
In fact, about 35% of people with a vagina will get bacterial vaginosis.
What about the new vaginas that are being made these days?
I don't
Can they
think-
get it?
I don't think so, because I don't think they have the bacteria.
I wonder if they're sterile vaginas.
They must be, right? Because the lining is like other
body
skin.
parts. All right.
Yeah.
Fair enough.
It usually occurs in people who are sexually active, and it's rare for it to occur in people who've never had sex. You may have a higher risk of getting BV if you are pregnant, you don't use condoms or dental dams, if you have an IUD, if you have a new sex partner, if you douche, or if you are taking antibiotics, because that also...
You're not supposed to douche.
You should never douche.
You're not supposed to douche because it ruins the bacterial process.
It's a self-cleaning oven.
Yes.
And when you mess up the self-cleaning oven
It messes up everything
it doesn't
else.
clean.
Yes.
Get quite an education.
No.
Yeah.
That's why people listen to us, Brian. That's why they listen.
Up to 84% of people with bacterial vaginosis do not have symptoms. But if you do, they may be off-white, gray, or greenish-colored vaginal discharge.
I am so glad we're eating after this.
Fishy smelling vaginal discharge, especially after sex.
Nothing better than a fishy smelling
Vaginal itching or irritation. Or a burning feeling when you pee. You can't get BV from hot tubs, swimming pools, or toilet seats. You also can't get BV from touching a surface that a person with BV has touched. It's not
communicated
it's
like
not
that.
It's not an STI, but it's linked to sexual activity. So that's why we're talking about it. Bacterial vaginosis doesn't spread from person to person, but the sexual activity increases your risk of getting the infection. How do they diagnose it? They are going to perform a pelvic exam.
Woo, girl, you got BV.
And they're going to take a sample of your vaginal discharge. And then they're going to do wet mount, which is a test that involves looking at your vaginal discharge on a glass slide under a microscope.
It has nothing to do with sex.
No. A whiff test. Your provider smells your vaginal discharge.
I don't want to be the person that has to do with the whiff test.
No.
Oh, no, yep, yes,
That's
you
it.
have it, yep.
And a vaginal pH, and this measures how acidic your discharge is. A higher pH may indicate BV. Your healthcare provider will prescribe you some antibiotics, typically Flagyl or clindamycin. These medications come in a gel or cream you can insert into your vagina, but they sometimes also just give you a pill that you can take. Some cases will resolve on their own without any medications, but if you're having symptoms, you should see a doctor, because you can have this without symptoms. It's like, okay, but if you have symptoms, you should see a doctor. And BV does make you more prone to sexually transmitted infections and can affect pregnancies. So if you think you have this, you should go get seen. Most of the time, one round of antibiotics you take it for 7 days and it eliminates the infection. About 10 to 15% of people need another round of treatment. And you can get it as many times as
it warrants.
As you get it. Up to 80% of people get bacterial vaginosis again in their lifetime.
Ugh.
It doesn't typically cause any serious complications, but if it's left untreated, it can lead to complications during pregnancy, like premature birth if you are pregnant when you have it, STIs because it increases your risk, especially for like chlamydia and gonorrhea. And if you have HIV and get BV, you're at a higher risk for passing it on to your partner.
Oh, I believe that because...
and you're at a risk for pelvic inflammatory disease.
To be discussed later.
Yeah. And we'll talk about that later. And so how do you lower your risk of getting BV? Avoid douching. Do not change the natural balance of your vagina. Avoid vaginal contact with anything that has touched your anus. Like white
toilet paper.
White from front to back. Limit your number of sex partners. Use latex condoms or dental dams. And wear cotton or cotton-lined underwear. Bacteria thrives in moist environments. Cotton helps to wick moisture away. And that is BV.
Well, that ties in to an Instagram reel that I watched today.
Okay.
It is a Vietnamese man doing toes. He's doing a pedicure.
Oh.
And he is like, whew. I don't know if he knew this patient or this person has this issue. You cannot see the person's face. And he's like, oh, honey. Oh, no. Your kitty is bad. And she's like, what? And he's like, I do these all the time, though. So I sit right here. So he's like thick. Yeah, he's level. Yeah. He's like, and your kitty, no, it don't smell no. It's too much. And she's like, what do you mean? He's like, you need to clean it. And he's going on, and I would die if my pedicurist told me my china stunk.
Yeah.
I would be horrified. Yeah. But how do you not smell it yourself?
I don't know. Just if there's something like that going on, you need to go to the doctor.
Yeah, that's a little freaking horrifying.
Yeah.
I don't know how you don't know that your hoo-ha smells like fish. All right.
I don't either.
I am going to follow that up with the side of trichomoniasis.
Ooh, sounds terrible.
Yes, it is. But it's a very common STI infection. Symptoms vary, and people who have it don't know it. In the United States, the CDC estimates that there are more than 2 million trichomoniasis infections as of 2018. However, only about 30% develop any symptoms of trick, which we're going to call it Varroa.
Okay.
Or trick. It is more common in women than men. Older women are more likely than younger to have this infection. So I am more likely to have trichomoniasis than BV or trick. Signs and symptoms. Although about 70% of people with infection do not have any signs and symptoms, when it does cause symptoms, they can range from mild irritation to severe inflammation. They can get symptoms within 5 to 28 days after getting the infection, and they often do not develop symptoms until much later.
Yeah.
They can be itching or irritation inside the penis, burning after peeing or ejaculating, discharge from the penis.
Oh.
Women may notice itching, burning, redness, or soreness of the genitals, discomfort when peeing, clear, white, yellowish, or green, we covered all the spectrum, or greenish vaginal discharge, thin discharged or increased volume, with a fish smell.
Oh, it's fish.
Having trick can make sex feel unpleasant. Without treatment, the infection can last for months or even years.
I'm just going to say this.
If you have a stinky one?
If this shit's coming out of you, why are you feeling like you should have sex?
Laura, have you ever looked at the world population and see who has reproduced?
I know, but aren't you like, I don't really want to do this. It
I look
stings
at
when I pee. Like, why are we?
I look at some of these patients who come in and we're pulling their teeth because they're so rotted. And you can smell their breath 3 rooms away. And they come in with their spouse.
I know.
Who have multiple children. So that didn't happen overnight. Somebody's kissed that fucking mouth multiple times. All right? So if his mouth or her mouth is like that, what is the rest of the shit like? Do you know what I mean?
I know.
This is what people are seeing, and you don't take care of it.
I know.
All right? It's not always a self-cleaning oven. So, yeah, you got people having sex.
You
I love
want to, though.
Well, I think if you're on meth, you probably don't smell anything. I don't know. Okay. Trick can increase the risk of getting, or it's very similar to BV, so it can increase the risk of spreading other sexually transmitted infections. For example, it can cause genital inflammation, making it easier to get HIV. It is spread. Sexually active people can get trick by having sex without a condom with a partner who has trick. In women, it is most commonly found in the lower genital tract, vulva, vagina, cervix, and urethra, also known as vagina. In men, the infection is most commonly found inside the penis, in the urethra. During sex, the parasite usually spreads from penis.
Oh, it's a parasite.
It's a parasite.
Oh.
I always find if it starts with trick,
yeah, it's a parasite.
It's a creature of some sort. So it spreads from penis to vagina or from a vagina to a penis. It can also spread from vagina to another vagina. Oh. Now it's getting real. It's not common for the parasite to infect other body parts like the hands, mouth, or anus. Oh. It is unclear why some people with the infection get symptoms while others do not. It probably depends on factors like the age or overall health. Well, since this is older people, well, the shit's getting real in the nursing homes, maybe. People with trick can pass the infection to others even if they do not have symptoms. So how do I prevent it? Like you would any other STD. The only way to avoid STDs is to not have vaginal, anal, or oral sex. But since that's not going to happen, you could be in a long-term mutual monogamous relationship with a partner who does not have it. Using condoms the right way every time you have sex. I don't know how you would use them the wrong way, but
a lot of people seem to use them the wrong way.
Yeah. What are they doing with them?
I don't know.
All right.
I don't know.
Also, talk about the potential risk of STIs before having sex with the new partner. It's Valentine's Day. You're having dinner, glass of wine. Do you know I have trichomoniasis? Please, let's do this carefully. Put condom on the right way so it doesn't go from my vagina into your urethral tract. Like, how do you have this conversation at dinner?
Yeah.
Okay.
I mean, you probably don't do it at dinner.
No, you probably don't still. Yeah. When is the right time to have this conversation? Before it happens?
After.
Immediately after. Oh, right away. If you have a fishy smell, it's me. If you are sexually active, have an honest talk with your partner and your healthcare provider. Okay. Recovery. is the most common curable STI. A health provider can treat the infection with medication taken by mouth. The treatment is also safe for pregnant women. If you receive incomplete treatment for trich, you can still get it again. Reinfection occurs in about 1 to 5 people within 3 months after receiving treatment. This can happen if you have sex without a condom or a person who has trich. To avoid reinfection, your sex partner should receive treatment at the same time you do. Or all of your sex partners should have treatment.
Yes.
You should not have sex again until you and your partner complete the treatment. You should receive testing again about 3 months after your treatment, even your sex partner received treatment. So are you saying they got to wait 3 months? These people ain't waiting 3 months. My husband would die if he had to wait 3 months. He would crawl up and die.
If I had a parasite.
Have you met my husband? He would crawl up and die. I could go 3 months, no problem at all. Mm-hmm. All right, Laura, take it away with number 2.
I'm doing, well, it looks like cancroid, but it's called chancroid. So that's a weird one. Chancroid.
Tomato.
It's a very contagious type of STI. It occurs when the bacterium Haemophilus ducreyi infects your body.
Hemophilus? Like hemophilia?
Haemophilus.
Homophilus? I don't know.
I don't know.
Just throw that out there.
It is not common in the U.S.
Chancroid.
Cases to the world, luckily, seem to be going down. But you're more likely to get it if you live or visit areas where it is common. Another name for chancroid is soft chancre. The time between when you encounter the bacterium and when you develop symptoms is about 3 to 7 days. So you're going to see this within a week. Mm-hmm. The early symptom is small, raised, painful bumps on your genitals. The bump grows into a sore or a lesion or an ulcer.
Chancroid.
Mm-hmm. With ragged, soft edges about a day later.
Ragged.
Uh-huh. And then you may develop other symptoms like bleeding, discolored and shiny skin on the sores, enlarged lymph nodes in your groin, leaky pus and infectious fluid, pain while peeing.
Nobody wants leaky pus.
No. Pain during sexual intercourse, sores that spread or connect to other sores in a larger area.
All right.
The ulcers range in size, usually from 1/8 of an inch to 2 inches.
Ooh, that's big.
In diameter.
That's big.
Yeah.
If
you have a penis.
The average penis is 5.5 inches.
Yeah, that's like half of it.
Yeah.
If you have a penis, they typically appear on below the rounded border at the bottom of the head of the penis, the foreskin, the head of your penis, opening of your penis, the penile shaft, and the scrotum.
So the penis.
Yeah.
Anywhere on the penis.
If you have a vagina, they will normally appear on the area of skin between your anus and vagina, or your perineum.
The taint.
Yeah. Your inner thighs, your labia minora, or the labia majora.
So the vagina.
Yeah. But not like up in the tract.
Not in the canal.
Yeah.
Not in the vault.
No. It usually spreads through sexual intercourse, like I said, but it can also be transferred to someone else if they encounter the infected fluid that leaks from the sore.
Why would you have sex with a male who's got a 2-inch sore on his penis that is leaking pus?
I don't know.
Have you not looked at this thing before you have allowed it into your human body?
If you were like changing sheets or something and someone was on it.
Ugh.
They think it enters your body through tiny abrasions in your skin during sexual activity because it doesn't infect skin without abrasions. Like if you are completely intact, you're not going to get it. But if you have a little cut, you're going to get it. And
yeah,
you know that occurs. Anyone who has unprotected sexual intercourse can get chancroid. It's more common if you still have foreskin on your penis, if you are uncircumcised. And you're less likely to have symptoms if you have a vagina. Again, the cases in the U.S. and Europe are low. There are sporadic outbreaks, so you still have to watch for it. But it's more common in the Caribbean, certain regions in Africa, and Southwest Asia.
Weird.
Yeah. And so if you're there, you
be careful.
Get it.
Don't change the sheets.
Yeah. If you have chancroid, it can be easier to transmit HIV. Without treatment, you're at a higher risk of getting a soft tissue infection, developing a fistula, which is like a tunnel between some of your, like,
extremely painful,
between your vagina and your anus. So, like, sometimes if you're pooping, it can come out of your vagina. And genital tissue death or necrosis of the genital area. Chancroid can be challenging for healthcare providers to diagnose. Again, we don't see it a lot here, but they can get a special bacteria culture test that detects the bacteria's DNA. However, the U.S. Food and Drug Administration hasn't approved that test for the U.S.
Oh, great.
Because of these testing difficulties, the providers usually rule out other diseases like syphilis, herpes, and LGV. They'll diagnose
I'm going to talk about LGV.
I
am.
They'll diagnose chancroid if you have one or more genital ulcers that cause pain, you have swollen and painful lymph nodes in your groin, and you test negative for herpes infection and yaws. Antibiotics can treat chancroid. They'll either prescribe azithromycin, ceftriaxone, ciprofloxacin, or erythromycin. They can also recommend a needle aspiration to drain any of the swollen areas on lymph nodes if you have that. They can go away without treatment, but the sores will likely clear up on their own in a month or two, but you're at higher risk of complications if you don't get the treatment, like the necrosis and all that.
Why would you
stuff.
let that wait for 2 months? That must be painful.
I think people are embarrassed.
Yeah.
They will start clearing up in about 1 to 2 weeks after getting treatment. If you have a severe case, you can get scars from where the ulcers were.
Ouch.
Yeah. You can prevent it by abstaining from sexual intercourse or practicing safe sex, including using condoms that cover any affected areas anytime you have oral, vaginal, or anal sex, having sexual intercourse with only one uninfected partner, making sure you or another person doesn't touch any leaking pus or fluid from an infected area.
Ugh, never touch leaking fluid or pus on anything.
No. Getting an annual STI test, including before having sex with a new partner.
Boom.
That is that.
And that is that about that disgusting chancroid.
We can give that a more pleasant name.
Chancroid.
It's bad enough you have it, but you have to say I have chancroid.
And not even a cancroid. It's a chancroid. It must be an English thing.
I'd say cancroid.
I would say cancroid all day long. Yeah. It just sounds worse too.
Yeah.
All right. I want to talk about lymphogranuloma venereum, also known as LGV, which can be contracted through vaginal, anal, or oral sex with a person who has the infection. Unprotected sex carries a higher transmission risk. Are we seeing a common theme with these, Laura?
Just be protected.
Protect yourself. Wrap that shit. LGV is an infection caused by L1, L2, and L3 serovaz variations of C. Trachomatis bacteria.
Oh, obviously.
Clearly. But Laura, they're not the same strains of C. trachomatis bacteria that causes chlamydia. Did you know that?
No.
It's a different one.
I didn't know.
All right?
That.
It typically infects the lymphatic system, which is why LGV often leads to swollen lymph nodes.
Oh.
Risk factors. Anyone who is sexually active can get LGV. However, you are at a higher chance if you are a man who has sex with other men, are between the ages of 15 and 40, and sexually active. You have HIV. You have multiple sexual partners, often have unprotected sex with people you do not know well, and you often engage in certain acts such as anal sex. Where you live can also factor in how likely you are to get LGV. The infection is more common in tropical and subtropical regions. For instance, LGV is more common in Central and South America and North America. Okay. All right. How is it diagnosed? It can sometimes be hard to diagnose. Blood tests can differentiate LGV from other kinds of STIs, or in my day, STDs, but they are not available everywhere. If there is a test available near you, they may not come back in a timely manner. Oh. Instead, it is diagnosed through a physical examination of your affected area and information about your sexual history and symptoms. They may take specimens from your genital lesions, throat, rectum, and lymph nodes to check for what type of bacteria is causing your symptoms. Yeah. other LVG diagnosis is confirmed, you may test for other STIs while you're at it. So there are 3 stages to LVG. So before we get into the stages, this is my husband making a drink if you're hearing any noise in the background. God forbid he sits still for 2 minutes.
He did ask permission.
All right. So LGV is sometimes asymptomatic, meaning it might not cause any symptoms. But if it does, they come in 3 stages. The early symptoms from the first stage of LGV are more apparent among men. Women only realize they have signs of it after developing complications from the later stages of the disease. Correct.
That's nice.
So the first stage. First symptom is the development of small, painless bumps that is either filled with pus, pustule, or no pus, papule. This usually occurs 3 to 30 days of exposure to the bacteria. Sometimes it develops into an ulcer or sore. Sometimes it appears on the cervix, urethra, vagina, or rectum, and goes away on its own after about a week.
Yeah.
Kind of like syphilis. In the meantime, you might have discharge that is a mix of mucus and pus for your rectum, urethra, or cervix. These are just lovely things happening to the human body. In the second half of the first stage, LGV may progress to proctitis. The rectal inflammation makes it so that the LGV symptoms are so similar to those of inflammatory bowel disease.
Oh.
Symptoms during the second phase of the first stage: rectal pain, bleeding from the rectum, painful bowel movements, the feeling of needing to have a bowel movement but being unable to go, also known as tenesmus. I have that all the time.
I was going to say, maybe I have
it constantly. ABD pain and mucus in the stool. This is a good time. This is a good fucking time. Look at this. You're going to shit yourself from an STD. It's great. All right, second stage. We've made it finally to the second stage. During the second stage of LGV, symptoms can become symptomatic, meaning they affect your whole body. Could you make any more noise? Sit down. Take your nuts and sit down.
He went to the pretzels.
He went to the pretzels. Mm-hmm. You might as well just put the bowl in front of you. He's going to eat the whole fucking thing of pretzels. All right. So during the second stage of LGV, symptoms can become symptomatic, meaning they affect your whole body. You can experience fever, swollen genitalia, swollen lymph nodes in the groin, rectum, neck, or armpits.
Swollen lymph nodes in your rectum?
Swollen genitalia.
I'm just saying.
Okay.
That's what's going to happen if you get up one more time. Severely swollen lymph nodes that may go up and down in size, in rupture, arthritis, lung inflammation, also known as pneumonitis, swelling of the lining in the stomach. I think this might be top.
How have I never heard of this?
I have swelling of the lining in the stomach and surrounding the liver. So you can shit yourself, and now you're going to have the swollen stomach lining, the arthritis, and you're rupturing your lymph nodes. All right, we're not done yet, though, because there's a third stage, Laura.
It gets worse?
It gets worse. During the third stage of LGV, you may experience severe health complications because shitting yourself and your stomach lining.
Swollen liver.
Yeah, those aren't enough.
Okay.
Now you're going to get genitoanorectal syndrome.
No, I don't want that. I don't know what it is. I don't want that.
All right.
Sounds awful.
Genitoanorectal syndrome. It involves chronic inflammation of the affected areas, hence in the name, genital and rectal. Brain inflammation.
Oh.
Severe swelling of the genitalia, elephantitis. So you're going to get balls that you can't put a bag of peas on. These things are going to be fucking huge.
I'm going to be sitting on them.
Fistula, abnormal connections between the vagina and the rectum. So now it's a vaginum. Narrowing of the anal opening strictures.
Oh, so now you can't even.
So now you're going to be shitting ribbons. Inflammation of infection of the eyes, joints, and vital organs. And scarring of the genitals or rectum. Again, this is a good time.
I've literally never heard of this.
I've never heard of this, and hopefully it's because nobody has ever done this. All right, so that is it. Treatment for this shit. The treatment is to clear the infection. First line treatment is antibiotics. If you are diagnosed with LGV, they will most likely prescribe doxycycline to instruct you to take it twice a day for 3 weeks. If you're pregnant, you can't take doxycycline for another reason. You may be prescribed Zithromax or erythromycin for 3 weeks. You may need to take antibiotics longer if you have major complications. Mm-hmm. Your healthcare provider may want to follow up with you for several months to ensure they have subsided. They may recommend a follow-up test after 3 months to confirm that the infection has been cleared to prevent it. The only guarantee way to prevent it, or any others, is to avoid sexual contact, which nobody seems to be doing. So we're going to use condoms during oral, vaginal, and anal sex. If you've had somebody with this in the past 6 days that you've had sex with, you should go to your healthcare provider and get on preventative antibiotics.
Immediately, so this shit doesn't happen.
So you don't get genitoanal rectum syndrome.
Oh.
If you don't have any symptoms to confirm a diagnosis, they may prescribe you oral doxycycline anyway, just in case.
Yeah, just give it to me.
If your LGV is treated, you can have a complete recovery, but sometimes LGV can cause complications, especially in the later stages that can last for years if you don't have it treated. Yes. And that, my friends, is the unknown STI of LGV.
That is awful.
That is a party in your pants right there.
That is something.
That is a good time. What you got? What are you following that? What's the side dish we're getting with this, Laura?
I have, my last one is non-gonococcal urethritis. NGU, and that's what we're going with.
Yep.
It's an inflammation of the small tube that allows you to pee. Your urethra. It's a common sexually transmitted infection that occurs after having unprotected sexual intercourse with a partner that has an NGU infection. But there are also non-sexual causes. It can affect anyone, but men are more likely to have NGU. Another name for it is non-specific urethritis, or NSU. So they're interchangeable. It's very, very common. They treat NGU more than any other STI in men.
Wow.
Yeah.
I believe that. I do believe that.
In men, early symptoms may include leaking discharge from your penis, pain while peeing, pain while ejaculating, itching, irritation or tenderness, and abdominal pain. Without treatment, the infection can get worse, and more severe NGU symptoms in men include testicular pain and swelling,
ouch,
infertility, signs of infection that affect other parts of your body, including fever, chills, headache, and fatigue.
But Laura, will they get elephantitis of the balls?
It does not mention elephantitis. Just a little swelling.
If they're not going to get elephantitis, I don't think it's worth the time.
But infertility is
pretty bad.
Yeah. Women usually have fewer NGU symptoms, but they may include vaginal discharge, pain while peeing, pain during sex, and spotting or cramping throughout the month or irregular periods. What does it feel like?
Feels like a hot poker up your hoo-ha?
Feels uncomfortable. You may have burning or stinging feeling when you pee or ejaculate, and you may also feel an annoying itch inside your urethra.
Oh, and how do you scratch that?
You can't scratch that.
I can't even get in there and scratch that
You can't scratch that.
That's how you end up with like a light cord up there because you'd been trying to shove something up there.
Yeah. STIs are the main cause of NGU, and you may pass STIs through unprotected vaginal, oral, or anal sexual intercourse. Again.
The main theme, protection. Protection.
Yeah. Many types of germs cause NGU. Most common, it's chlamydia. But other common bacteria are vaginalis, genitalium, and ureal ticum.
You're a real tickum too.
You're a real tickum. The herpes simplex virus in trichomonas can also cause NGU.
So is NGU like a symptom of these things?
It's when your urethra
gets inflamed because of these other bacteria, though, or you know what I mean? All right.
Yeah. But there are non-sexual causes. If your foreskin is too tight,
you
can get NGU.
Oh, ouch! And why would it be too tight?
Using a Foley catheter.
I can see that
during a medical procedure or why you need to use a Foley catheter can introduce
do it at home.
Stuff in there.
Just like to.
And inflame it. Narrowing of your urethra or urethral stricture and UTIs. If you get NGU from bacteria, symptoms usually develop 1 to 3 weeks after the infection. Anyone can get it, but you're higher risk of developing NGU if you are between the ages of 15 and 30, have unprotected sex, have more than one sex partner, or experience trauma to your urethra.
That's like a good term.
Injury from a Foley. NGU generally goes away without complications, even without treatment. In rare instances, untreated NGU can lead to other complications, such as epididymitis,
Ooh.
which is the inflammation of the tube in your testicle, and that can cause testicular pain. Reactive arthritis. It affects your back, your joints, your urinary tract, and your eyes.
Ugh.
Skin lesions.
Leading all to the blindness episode.
Yeah. And vaginal infections. These may include mucopurulent cervicitis. Anything with purulent is not good. And vaginitis. And those can lead to, if untreated, pelvic inflammatory disease.
Which we're getting into. It's happening.
How do they diagnose this? A physical exam. And then they're going to take a cotton swab.
And shove it up there.
Yep. Put it right up your urethra to conduct a bacterial culture set from one of the following areas. Your urethra, your cervix, your rectum, or your throat. Ugh. It's possible to have multiple STIs at the same time, so they're going to test for everything. They will prescribe you antibiotics if you have it. And they usually use doxycycline again twice a day for a week, or macrolide antibiotics such as
I might just take preventative doxycycline just for shits and giggles.
Yeah, just give me a thing of dox. If you're allergic to these, you can use erythromycin or ofloxacin.
Ofloxacin.
You and all your partners should all receive treatment.
You all get a dose of that for Valentine's Day.
NGU back and forth.
Not a box of chocolates, you get a box of antibiotics.
Yeah. And it might take a week or two for your symptoms to go away after starting antibiotics. And if you didn't get it treated, it can go away in a few weeks or up to 6 months. If you're only able to spread NGU if it results from an STI. So if you've got it because of the STI, you can
But if you got it from like a Foley, you're good.
But if you got it from Foley, you cannot spread it. And take your antibiotics. Finish them the whole way through.
Oh,
Don't
that's
stop
for anything.
Halfway through, because that's
for anything, anytime.
How to prevent it? Use a condom. And use a new one, it says.
Why? Why, God, why?
Avoid sexual intercourse if you suspect your partner of having an STI or NGU. Get tested for it before you have sex with the new partner, and get regular STI tests if you have multiple partners.
Oof. Yep. Well, Laura, we're going to finish up this Valentine's meal, the lovely dessert of pelvic inflammatory disease.
Nice.
And because it would be like a molten lava cake for me, because it's going to come in all hot and nasty. All right? Can't get enough of this shit. I will say, back in my days as a scrub tech, having seen, they did a scope on a girl and she had PID, and it shit ain't no joke. The inside was just nothing but adhesions. I'd never seen anything like it. Mm-hmm. So what is pelvic inflammatory disease, which we will be calling PID? It is a serious infection in your uterus, fallopian tubes, and or ovaries. It affects females, obviously, because they're the ones with the uterus, fallopian tubes, and ovaries. PID develops when certain types of bacteria spread from your vagina to your reproductive organs. Bacteria from untreated STIs are the most common cause of PID. However, bacteria normally found in your vagina can also cause it. When you have PID, you may feel pain in your lower abdomen or belly. You may have unusual discharge leaking from your vagina. Oh, you never want discharge that's a color coming from your vagina. No. Severe PID can cause permanent damage to your reproductive organs and prevent you from getting pregnant. This is actually a huge problem for girls, and they don't realize a lot of them are not getting pregnant because of the scarring. Mm-hmm. The best way to prevent it is, getting treatment for these and getting tested is the best way to prevent it from happening. So if you're sexually active, getting treated. How common is it? Each year, more than 1 million females in the U.S. get it, and more than 100,000 people become infertile because of it.
Yikes!
That's pretty high.
That's
PID,
like 10% of the. Wow.
Yeah, PID occurs most frequently in females between 15 and 25. You may not realize you have it. The symptoms might be mild or noticeable, but they can also start suddenly, and they can include pain or tenderness in your stomach or lower abdomen. This is the most common symptom. Mm-hmm. Abnormal vaginal discharge, usually yellow-green with an unusual odor. Again, any color or weird smell coming out of you is never good. Mm-hmm. Chills or fever, nausea, vomiting, pain during sex, burning when you pee, irregular periods, or having spotting or cramping throughout the month. Where do you feel the PID pain? In your lower abdomen or pelvic region. You may feel a tender or sore or a light dull ache. What causes it? It's caused by bacteria entering your reproductive tract, causing an inflammatory disease. The bacteria are passed from your vagina through your cervix and up into your uterus, fallopian tubes, and ovaries. When bacteria enters your vagina, your cervix usually keeps them from getting to the reproductive organs. However, this type of infection fucks with the cervix, preventing it from doing its job. So many types of bacteria can cause PID, but the two most common infections are gonorrhea and chlamydia.
Gonorrhea and chlamydia are just hand in hand with all this shit.
And people don't realize how nasty those two are. And they're very common, but they're very bad.
Yeah. I mean, they're nasty on there, and then they all seem to...
They bring friends with them.
Yeah, they bring all their friends.
These are a party. Yeah. They don't come alone. You get both of these infections through unprotected sex. These two STIs cause about 90% of all PID cases. Oh. Less commonly, PID happens when normal bacteria gets into your reproductive organs, like after childbirth, pelvic surgery, miscarriage, getting an IUD. There's a risk. The risk is highest in the few weeks after you have been inserted with the IUD. Yeah. It can take anywhere from a few days to a few weeks to develop PID if untreated gonorrhea or chlamydia is the cause. If you get it from something else, it could take several months for it to develop. Most studies report an association between douching and PID. What can be said is that douching can lead to bacterial vaginosis infections, but there's a potential association between it and PID.
Well, you could see how,
yeah.
Shoot it on up there.
It's most often spread during direct sexual contact. Remember as a kid there'd always be commercials for douches?
Yeah, now you never see it.
You don't even see it on the, there's a reason, because it was always bad, Who's at risk? You have a higher risk if you have sexually transmitted infections like gonorrhea or chlamydia. You have many sexual partners, and you have had a partner who has had many sexual partners. You have had it in the past. You were sexually active and younger than 25. You have had a tubal ligation or other pelvic surgeries. What other complications? The longer you have it, the more serious its effects can become. The infection can cause serious scar tissue to form inside your fallopian tubes. And I'm telling you, it looks like a honeycomb in there, which is why the egg can't get through. It's just all this white tissue that it's weird. Chronic pelvic pain, long-lasting pelvic pain is the most common complication. One study estimates about 20% of people develop chronic pelvic pain, ectopic pain. It can prevent a fertilized egg from moving into your uterus, and this causes it to implant inside your fallopian tube, and then your fallopian tube can rupture, and you can bleed to death. Infertility, up to 10% of people with PID lose the ability to get pregnant because scar tissue blocks their fallopian tubes and prevents it from releasing the egg at all. TOA, which is tubo-ovarian abscesses.
Oh.
It is a pocket of infection in your pelvis that can make you extremely sick. How is it diagnosed? If you feel like you have symptoms of it, go to your healthcare provider right away. The sooner you get care, the greater your chances of success. There isn't one specific test for it. You can diagnose through a medical history, a pelvic exam, or culture. You can also do blood tests, urine tests, ultrasounds, or tests for STIs. In some cases, you can have an endometrial biopsy or a laparoscopy, which is how I've seen it done. It is treated with antibiotics by mouth for 14 days. You have to, as we just said, take all of your antibiotics. Some symptoms improve before the infection goes away, but you still need to be taking your antibiotics. Some people take them and still have symptoms. If you have them and you need to go to the hospital to receive antibiotics through an IV, you may need an IV medication if you are pregnant, have a severe infection, and feel very sick, or you have the abscess on the fallopian tubes or that we talked about. Yeah. And you shouldn't have sex until your treatment is finished. And when you do have sex again, you need to use a condom. Very rarely do you need surgery for it. Your sexual partner probably doesn't need treatment. You can tell them. Maybe they should receive treatment, but they're not going to have, if it's a male, they're not going to have a problem with reproduction. Otherwise, you can get, if they have it though, you can get it again. Is there a cure? If you get prompt diagnosis and treatment for an infection, antibiotics can cure PID, but treatment you can't reverse any damage that's already happened to the organs. So don't wait to get treated. You can possibly have trouble getting pregnant. It can affect your fertility. You can get it again. Getting it once doesn't prevent you from getting it again. And I think that is all I have to say about PID.
That's pretty terrible.
It's pretty terrible. Like I said, it looks like a honeycomb in there, and then it's really You think that 1 minute at 18 isn't going to affect you, but there you are at 30 trying to have a kid, and you can't because of this issue you had at 18 and didn't know about it. So on Valentine's Day, instead of getting a box of chocolates, get a box of condoms.
And
get
before
every flavor.
dinner, go get your tests.
Go get all your. I want a clean bill of health coming up before you ever show up before to take me out to dinner at the chat house.
Right.
All right. I want to see clean bill of health. Okay.
All tests.
And have this conversation like, hey, listen, I've had gonorrhea, chlamydia, crabs. I mean, you can list everything you had, see if you're still interested.
Right.
You know?
He might not care.
Yeah. You might not care. If you're drunk enough, who knows? Just wear a condom.
Right.
All right. So happy Valentine's Day.
Happy Valentine's
Hope you all have a lovely, safe, STI-free Valentine's Day.
Yes.
And we will see you in a couple of weeks. Send in your emails. It's after Christmas, so you should have time now. Send in your emails and your ideas for shows for the future because we are getting tapped, people. Getting tapped. See you later.
Bye.
Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.